Okay, so this is a quick revision on testicular examination first. In testicular examination, we have three main symptoms in addition to the teaching cases. What are the three main three main symptoms? What are they? Mass, pain, and erectile dysfunction. All right, these are the three main presentations: mass, pain, erectile dysfunction. In teaching, you will teach inguinoscrotal hernia or swellings and urogenital examination. All right, these are the cases that you can find mannequin of genitalia. All right. Okay, so let's start by mass. In mass, you can find four main possibilities. What are they? Either cancer, so either normal examination, okay, the patient presents with mass, but when you examine, you find nothing. Examination is normal, all right? Or cancer, or spermatocele or epididymal cyst, and lastly, hydrocele. Hydrocele is a very, 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 very rare case, okay? But you never know. You might have it, okay? So either normal, cancer, spermatocele or epididymal cyst, and hydrocele. Okay, these are the four main possibilities in testicular mass. In testicular mass, as any mass, you explore the mass. Since when, where exactly the mass, any masses anywhere else, is it getting bigger or not, and the skin over it. All right, what about the skin over it? Is it red, swollen, any discharge? All right. Any specific thing happened, you can ask this question. Then in anything else, you ask about pain. Any mass, you ask about pain and discharge from the mass or from the penis. Okay, so pain, discharge, any blood coming out from the mass or any blood coming out from the penis, and flows symptoms. All right, fever, lumps and bumps, appetite, weight loss, and night sweats. You don't need to ask all of them, just pick up two and ask. Loss of weight and lumps and bumps. That's it. All right? This is the exploration. Then you move on to the past history. Did that happen before? Have you had any masses before? Any surgeries before on the genitalia? Why you need to ask about surgeries? Orchidopexy. Undescended tests and fixation of the testes. All right, this is a risk factor of cancer, testicular cancer. All right. Any medications that you are on, allergies is not important at all. Family history is important in cancer. All right, so you can ask any family history of cancer in the genitalia or testicular cancer, especially if the patient is concerned about cancer. Okay? And I highlighted undescended testes as a past medical history, as a what we call it, a risk factor of cancer. All right. Sexual history, to be honest, in testicular mass, I don't ask it. Okay, if you feel it's appropriate, you can ask, but in testicular mass, no. I can ask sexual history in testicular pain, more with testicular pain, but with testicular mass, no. All right, so I've written sexual if appropriate, if you feel like, if it's appropriate. All right. Psychosocial, you can ask, how have you been affected by these thoughts? You can ask this. Then you move on to ideas, concerns, expectations. Usually in combined cases, you focus on concern and that's it. Don't waste your time on, do you have any idea what might be the cause, any expectations and these things? Just concern. What's your main concern, Mr. X? All right. Then you move on to the examination. Check the observations. Explain to the patient what are you going to examine. You tell him, I'm going to have a look at your genitalia or your private area. At some point, I will feel the organ, or I feel that your testicles, all right? And it requires you to be undressed from down below or below your waist. At some point, I will examine you on the lying position first, and on while you are lying, and then while you're standing, if you don't mind. I provide a chaperone with me, and I will ensure your privacy. Shall I proceed? I'm going to wash my hands and put my gloves on. All right? This is how to start your examination. Then you examine. In any testicular mass or any testicular examination or private area examination, you inspect, you palpate, then you do special tests. And after that, you complete your examination by abdominal examination and lymph nodes. All right? So inspection, palpation, special tests, and completion of your examination by abdominal examination and lymph nodes. You verbalize that. I will complete my examination by abdominal examination and checking the glands in the lower part of your body. All right? As I mentioned, you will examine lying first and then standing. You tell the patient that, and then you'll start your inspection. All right? In your inspection, what you are going to inspect, the penis and the scrotum. The penis and the scrotum. All right? In penis, what you are going to inspect, hair distribution, if there's any scar or any discharge from the penis. Okay? You can find the simulation of the examination in the simulation video, all right, in the same folder of testicular examination. While you're watching the video, you find that I'm verbalizing what I'm seeing, okay? I'm verbalizing the findings, all right? Well, Dr. Sahar, can I verbalize, or it sounds awkward? My answer is it depends on the simulator. It depends on the simulator. You can just inspect and tell, after inspection, you tell the patient, I didn't see any abnormality while I'm looking at your genitalia, all right? And then you move on to the scrotum. If the examiner wants you to verbalize, he will tell you, or she will tell you, doctor, what are you looking for? All right? The video that I've simulated is an educational video. So while I'm doing the simulation, or I'm performing the examination, I'm telling you what I am looking for, just in case if the examiner asks you. All right? So this is in terms of penis. You examine, check the hair distribution, scars, and any discharge from the penis. And you ask the patient to squeeze his penis, all right? Yeah. Then you look at the scrotum from the front and from the back. Front, you check the skin, the symmetry of the testicles, and the level. Usually the left one is lower than the right one. All right? From the back, you check if there is any redness, scars, or swellings. These are the things that you are looking for. All right? If you find something, comment, highlight that you found a skin scar, or the right part is lower than the left part, which is not normal, or I found swelling in the right testicle or the left testicle. Okay? After that, you ask the patient to cough. Can you please cough for me? What are you looking for? You're looking for hernial orifices. All right? This is in inspection. Then you move on to palpation. In palpation, you tell the patient, I'm going to examine, or I'm going to feel the your testicles and your penis as well, if you don't mind, Mr. X. I just need to check if there is any mass or not. All right. Then you check the penis for any lumps, squeeze the penis for any discharge, and then you move on to the scrotum. Your examination in palpation is TTD. Check the temperature, if there is any tenderness, and then what are you going to see in the deep palpation? You feel the testicles for any masses and comment on the mass. All right, comment on the size, site, shape, consistency, skin over it. All right. If you don't want to comment or take too much time in commenting, tell him I found a mass, a lemon sized, or yes, usually it's a lemon size or olive size. Okay. And it's hard in consistency while you are examining. Okay. After that, you check the testicles, you move on to examine the spermatic cord and the epididymis. So you move on, from the testicles and above. This is the testicles, right? And above the testicles, you check the epididymis and the spermatic cord to find if there is any mass or not. Okay? While you are holding the mass, ask the patient to cough. All right? Then in special tests, we have 3 main special tests: trans-elimination test, Friends test, and cremasteric reflex. In masses, you just only verbalize or doing trans-elimination test. If you have a torch and paper, just perform trans-elimination test. And you can find how to do trans-elimination test in the simulation video. Okay? Friends and cremasteric are not important in testicular masses. Okay, doctors? Friends and cremasteric are important in testicular pain. All right? Why you need to do a trans-elimination test? To differentiate, is it, a cystic mass contains fluid or not, like hydrocele, transluminant or not, or is it opaque? So I'm thinking about cancer. Okay? After that, you complete your examination, as I mentioned, and then you move on to the management. Okay? I'm going to talk about the management right now, but in your examination, these are the possibilities. Normal, you don't find anything. Cancer, in cancer, you find a mass, which is hard in consistency, irregular in border, and you might find it fixed to the under or overlying structure. All right, this is a cancerous mass. Spermatocele or epididymal cyst, you find a mass either just on top of the testis, so this is spermatocele. Okay, just on top of the testis, this is spermatocele. If it's above the testis, there is a space between it and the testis, so this is epididymal cyst. All right? Okay, doctors? If you didn't manage to find to differentiate, is it spermatocele or epididymal cyst, just say I found a cystic mass above the testis. I'm thinking of 2 main things: spermatocele or epididymal cysts. Both of them are cystic mass and they are benign. Don't worry about them. Let's talk about the management. Okay, and you tell the management routine referral and give leaflets. That's it. Why are going to refer the patient? Just to do ultrasound to find the nature of the cystic mass. Okay, this is in terms of spermatocele. Hydrocele, you find the tests the whole test is swollen and the mass is around the tests. The mass is around the tests, all right? Not within the tests or above the tests. No, the test is the whole test is swollen, okay? And there is fluid around the tests, all right? This is in hydrocele. It's very rare. Okay, doctors? All right. These are the possible findings and the possible cases. How to manage? If it's normal examination, so you tell him, all right, I can see that you are concerned about having a mass. When I examined you, I didn't find anything. The examination is totally normal, reassuring. Everything is reassuring. Don't worry, Mr. X. Everything is good. I don't want you to be worried. What we are going now is just, you know, giving you an advice to regularly examine yourself. If you found any mass, please do come back to us. If the patient is above 50, you or offer the patient PSA test. PSA test is not related to the testicular mass. It's related to the prostate, but you offer the patient because the patient is above 50. Okay, it's you know, a checkup, a health checkup for the patients who are above 50. All right. If the patient is sexually active and he is not using the, you know, practicing safe sex, you can give him an advice on practicing safe sex. All right. This is in normal examination. In cancer, you have to deliver the diagnosis very, very sensitively. How to do that? Sensitive. So you tell him, you know, it could be something benign, but the fact you are losing weight or the fact that I found the examination is the lump is hard in consistency, and it's attached to the skin. The appearance of the mass itself is not reassuring, and we have to exclude cancer causes and give a pause. All right. Then if the patient is ready to listen to you, tell him, what are you going to do? Okay, what are you going to do? Ask for or order tumor markers, and then urgent referral to the specialist within 2 weeks. And if there is any time for you or any positivity of sexual history, you can advise the patient on sex. All right. In some cases, you can find the mass is not cancerous, but the patient has a history of undescended tests. In that case, what are you going to do?
Urgent referral.
Yes. All right. The mass is not cancerous. It's cystic, or it's regular and it's not hard. All right. But the patient has a history of undescended testes. You tell him, well, okay, from the examination is reassuring, doesn't show any alarming signs, but the fact you had a history of undescended tests before, and you had a surgery on it before, it increases the risks of having testicular cancer. It might be, but we need to exclude it just to be in the safe side. All right. This is in terms of cancer. And spermatocele, just routine referral, give leaflets, and that's it. All right. Hydrocele, you just try to find why the patient has hydrocele. If the patient has cancer symptoms, it could be the cause of hydrocele. Torsion tests which is rare. The patient will present by sudden pain. Okay, usually the hydrocele may be is due to cancer or without unknown cause. So you refer the patient to the specialist routinely. But if the hydrocele is in the age between 18 and 40, you order urgent ultrasound. Okay. All right, doctors. This is in terms of testicular masses. Okay.